onde tudo estava já muito bem definido e as minhas escolhas eram muito pouco passíveis de serem contempladas naquelas instituições. Mas talvez se na época tivesse uma opção, né, que houvesse uma instituição intermediária entre a minha casa e o hospital, onde eu pudesse ter conforto, onde eu pudesse ter humanização, acolhimento, e eu tivesse a garantia de que eu só iria acabar numa cesariana, de que se aquilo realmente fosse necessário, talvez teria sido uma opção naquele período.
Nesses 2 partos, eu estava lá e eu estava seguindo as ordens da equipe de saúde, que faziam os procedimentos sem me explicar o porquê, né? E no meu parto domiciliar eu pude ser eu, né? Então eu busquei escutar o meu corpo e fazer o que o meu corpo estava sentindo necessidade. Que essa equipe que for assistir seja uma equipe preparada para respeitar o tempo de cada mulher e a necessidade de cada família, né, e a necessidade de cada casal, para que esse bebê venha ao mundo da maneira mais amorosa e saudável possível.
Quando a gente avalia a mulher gestante que procura um atendimento hospitalar, ela procura com uma expectativa de buscar segurança, acolhimento. É que isso não é a realidade. Cria situações que muitas vezes são encaradas como violentas mesmo para a mulher, por conta de ter uma equipe que não está muito preparada nessa recepção da mulher de uma forma mais humana mesmo. Eu recebo mulheres, né, que trazem o bebê recém-nascido para a primeira consulta, que elas chegam com uma autoestima muito baixa, com uma desvalia por situações que elas vivenciaram dentro do hospital e não conseguem, às vezes, amamentar o filho por estar se sentindo não empoderadas, né, não se sentindo fortes o suficiente para conseguir fazer um parto normal, quanto mais para amamentar uma criança.
O investimento para uma atenção humanizada ao parto tem que ser um investimento focado nos recursos humanos, nas pessoas que estão trabalhando, atendendo os partos. A gente tem uma impressão que se investe muito dinheiro, se investe muito recurso na construção de centros de parto ou na reforma das instituições, fazendo suítes, PPP, que são maravilhosas, mas que não servem para nada se o pessoal que está atendendo essas mulheres não tiver uma mudança de paradigma. Quando a gente tem a equipe comprometida, a gente pode ter resultados maravilhosos em qualquer instalação. A gente pode ver o trabalho, por exemplo, da Melânia Amorim, lá em Campina Grande, que num hospital do SUS com pouquíssimos recursos, ela faz um trabalho voluntário que essas mulheres conseguem ter um parto maravilhoso, um parto humanizado que elas não teriam se elas tivessem dinheiro para pagar qualquer hospital ótimo aqui de São Paulo. Não precisa ter um grande investimento em
and they confirmed that. But it was quite a hard breach to detect, actually, because the consultants weren't so sure. But then, yeah, he was. And so we booked in for C-section.
There's obviously 2 different types of caesarean. There's an elective, which is a planned caesarean section, which is obviously a discussion between the obstetrician and the patient. And the obstetrician may well recommend a planned caesarean. Or there's an emergency caesarean, which is when a situation obviously crops up during labour or unplanned time. And these are decisions that are made between the obstetricians and the patients.
And I didn't quite know what to expect, how bad it would be. And I must have gone to the toilet about 6 times. Every toilet there was, on the way down to the theatre I'd stopped in it. And my husband was sweating. And so there was no question, we were really nervous, just going down. But then once we got there, the anaesthetist had met us prior to that, to going down. He'd met us that morning and talked us through everything. And he was brilliant. I found him really trustworthy, and that there was going to be no hidden surprises.
We have a theatre on delivery suite, and there's a resident anaesthetist 24 hours a day. So any decision of a caesarean section being needed means that we can be there in the rooms into theatre as soon as possible and anaesthetised promptly to enable a quick delivery.
And so when I went down, I met him, and just really reassuring. And he did the local anaesthetic, and there was another sidekick to him who was really helpful as well. And they were 2 good fun guys, and they sort of took my mind off it. You know, we were having a bit of a laugh.
Hospitals to get a patient to do business with them. Again, researchers here in Madison say that we are doing well. We're not seeing really many elective deliveries whatsoever take place before 39 weeks.
And so in the Jaeger's case, what happened? What's the end result here?
We're happy to actually report that Jessica actually gave birth to a little girl, a healthy baby girl, just a few days ago. Quinn and mom doing well. Turns out they could not talk their dean doctor into doing an elective C-section, and Quinn came naturally on Saturday morning, just a few days after her due date. And Jessica tells us she's actually really happy. She let it come naturally. She was a little anxious when she was going through the process, but she's really happy how it turned out.
Don't want to take
in a midwife-led unit or birth centre or at home, because they have thought about birth very carefully, and they really think that they'd like to try for a normal birth. I think they understand that midwives are experts in normal birth and are absolutely passionate about birth. This is where we actually let you labour. It's nice and homely and comfortable.
Oh, it's like a sitting room,
yeah, it is, and birthing balls to lean over on. It's also a very intimate experience because the women get to know their midwives during their antenatal period and become very confident in the support that they're going to get in that environment.
And after I'd had her and held her for a while and got rid of the placenta, then my husband cut the cord. The midwives came to check up on us a couple more times in the day, but that was really quite nice because they felt like family, and they just came in the bedroom, and you know, it was just a really nice atmosphere.
Some women won't be suitable for
hospital birth. You're not at home, but you can still make it feel home. You can take your own things in, and taking my music in helped. The fact that we had that ensuite room and we had an area that we could use and we didn't need to go outside the room, it was our space, was nice.
We're here to make everything as normal and natural and wonderful as it possibly can be, and only to intervene if really necessary.
It was the labour that I wanted, because I did want a labour where I had minimum pain relief, and in actual fact I managed to have a TENS machine. I think I had a couple of puffs on gas and air while I was examined, and that was it. So I didn't really have much pain relief, but actually that was good for me.
There are times that we know we need to assist the delivery, and that means using either forceps or a Von-2s.
It's a suction equipment for delivering a baby, and it's commonly used for assisted deliveries now.
People can choose to have an epidural if they want to, if that's what they'd like for pain relief, or sometimes we will recommend it. But if you have an epidural, they have to have a drip in their arm just to have some fluid, and then they have the epidural, which involves putting some local anaesthetic in the back and then putting a needle in. We try very hard not to give general anaesthetics to people. We try hard to use what's called regional anaesthesia, which is either an epidural or a spinal.
I've got diabetes, so women with diabetes have bigger babies. So I had my first baby, she was induced, but then I ended up having an emergency caesarean section. And then my second baby, we decided, with the advice from the consultant and midwives to have an elective caesarean.
The vast majority of elective and emergency caesarean sections are done under spinal anaesthetic, so the woman's awake. It's an enormous advantage that if she's awake, she's involved in the experience and her partner can be there.
You can kind of like feel something pressing on your tummy gently, but it's not painful, and you know, it's quite comfortable really, you just can't feel anything. I couldn't drive or hoof.
Infant, you're done with it. Wrap it up, give it to the mama, let her take over, record the information and notify the appropriate authorities. You will need to deliver the placenta. Remember, labor...
When you go to the dentist and get local anesthetic for dental work, we just deposit the local anesthetic near the nerves that innervate the uterus as well as the lower part of the body, so that when women have contractions and deliver the baby, they have good pain control and are able to enjoy the labor process better. As you can see, this is a little complicated, but this is a cross section, and this is the woman's back. The needle gets inserted close to where the nerve roots are in the spine, but not into the spine. And we deposit the local anesthetic so that it will affect the nerve roots and block the transmission of pain. I will show on our lovely model here exactly how the epidural will get placed. Of course, when you do have it placed yourself, the anesthesiologist will have gloves and a gown and a mask, but for demonstrations I'll just use my hands without a mask. The most important thing when getting an epidural is to be positioned correctly, and she's doing a great job here. You kind of have to have bad posture. We ask the women to kind of slump over with their shoulders slumped, as well as their back pressed out. We say either like a mad cat.
Care of a midwife, and all women need a midwife, and midwifery care for delivery can take place at home or in a midwifery unit if there is a freestanding one, or in hospital. And I would like to think that we can provide just the most basic but full midwifery care in the hospital unit, but should there be a problem, there are doctors around to help to intervene if necessary. There are some people who we would recommend, because of complications, have a baby in hospital. There are other people who would choose to have it. The underlying benefit is that if there were to be some reason that they would be better off with help from a doctor, then they're in the right place to get intervention if necessary.
I've got a blood condition.
So it would be sensible for them to go to a consultant unit. Tips for having a normal birth is to really get to know your midwife, talk to her about your options for birth, find out strategies for coping with normal birth and having confidence in your body to give birth to your baby. And a really important part of progressing to a normal birth is to understand the latent phase of labour, that early part of labour where we really encourage you to stay at home and sleep, you can eat, you can get in the bath and feel relaxed in your own surroundings.
It's great to be able to just sort of do what you want when you're in labour and just to feel comfortable enough to do it. Just sort of walking around and going to make some food in the kitchen or just do what you need to do really.
The pain relief that we have available to women who might decide to have a baby in a birthing centre or at home is we use aromatherapy, massage. A lot of women, if they're going to have their babies at home, will hire a pool. So this is our birthing pool, probably used by about at least 80% of our women. They absolutely love it.
Yes.
The water's very, very supportive. We do have gas and air or Entonox, which is helpful for the last stages. We do have injections that can help with pain, but we actually very rarely use them. So this is the ward. We've actually got 6 beds in here. Yesterday it was much fuller. We had 3 or 4 mums in here, but they've gone home, so we've got just the one today. It's really important that you discuss the options for your...
Who is a free birther and birthing expert, Claire Byam-Cook, and welcome both ladies. And our little lad here as well. He's what's he called? He's Rory. Rory. Yeah. Yes. So this was really an experience for you that started when you were about 22, because you're an ex-nurse and you gave birth to you've got 3 children.
Yes.
And he's the 3rd. And the first time round, the experience wasn't what you wanted, wasn't what you expected?
No, I mean, on paper, it was very straightforward. I went into hospital, had a 5-hour labour, and was discharged 6 hours later. But for me, it was absolutely everything I didn't want. Even though I gave birth with no pain relief, they insisted on monitoring me. The midwife was very focused on her monitors and on, you know, the rule book.
Yes.
What I was
a lot of people
expected
would
to
say
do.
maybe that wasn't such a bad thing to be monitoring, looking at the monitors and to be making sure that what was being said on those monitors wasn't going to cause a problem for you or for the baby.
Absolutely, but birth does not need to be over-medicalised. It's for the majority of women, it is a natural event. It's something that your body does, that women's bodies have been.
At Metro Health Hospital. I'm standing with Dr. Stephen Lown of Michigan OBGYN. This is a beautiful facility you have.
Oh, thank you, Rachel. It's great you could come here today and see our facility.
Tell us a little bit about it.
Well, our facility's new. We've been here for 3 years now, and it's the newest, most up-to-date childbirth center that there is in the Grand Rapids area.
State-of-the-art, very personal, very inviting. You know, it's a really important time when a family is about to have a child to come somewhere that they feel really comfortable.
Sure.
What exactly will they see when a family comes here to have a baby?
Absolutely. Well, what they can experience first is what we call the triage area, which is the area where we bring patients to assess whether they're really in labor or not. Once they're determined whether they're in labor, then it's like I said, they get the golden ticket, and then we admit them into the labor and delivery area, which is where we're at right now.
Yeah, and looking around, you've got a lot of wonderful accommodations here, probably the nicest I've seen.
No, it's just absolutely beautiful. It is.
It is. So you've got your TVs, you've got bright big windows, and this is a large room too.
Yes, and all our rooms are the same. All our labor and delivery rooms are centered on the outside here, so which again, compared to what the state of Michigan is with an overall decrease in births statewide, I think we're doing very well.
Wonderful.
What it is without looking at it.
Paper clip.
Okay, and now the other hand.
Key. Oh,
okay.
Sorry.
That's all right. I didn't give you very clear instructions, did I? Okay, let's try this again.
Okay.
Penny. Okay, excellent. All right. Well, that all looks very nice here. So let's take a look at your back. And the first thing I want to do is I'm just going to look at you, okay? And I want to look at your skin, particularly since you are so lovely and blonde and blue-eyed. Make sure there's no skin lesions there. And I already looked at the skin on your arms. And now would you please take a nice big breath in, okay, and let it out. Excellent. Okay. And I'm just going to tap on you a little bit. Okay, put this up. Okay, good. Okay, so that all sounds fine. And since you're not having any symptoms, I'm not going to do any fancy testing there.